Mind Over Matter, where science meets self awareness and healing begins with the right choice. Today's guest is David Jeter, a skilled physical therapist with Acceleration Physical Therapy in Spokane. With a deep focus on manual therapy and functional exercise, David is here to change the way we think about pain. Rather than rushing into medications or surgery, he believes the first step to musculoskeletal healing should be movement, alignment, and mindful care. If you have ever struggled with chronic pain or felt unsure where to turn, this episode will open new doors. So, David, many people go straight to pain meds or specialists when they're hurting. Why do you believe physical therapy should be the first line of defense for musculoskeletal pain?
Well, let me kind of take a little bit of a step back and let's think about what um, our Western medicine model is. And some of this is for a really good reason. You know, if you go into your physician and you say, "My shoulder hurts," there is a multitude of things that shoulder pain could be, right? So that practitioner needs to be able to rule out that you're having a cardiac event. They need to be able to rule out that you have some tumor or a blood clot or an infection or some big bad ugly thing, fractures, dislocations, all kinds of different things. Once that practitioner has identified that they are dealing with a musculoskeletal injury, something like a tendonitis or a bursitis or a degenerative joint disease sort of situation, um, that's where I feel like the Western model sort of gets a little bit muddled on what to do next because they're they're very good at identifying the painful structure, the thing that is the pain producing structure, but they're not very good at asking the question, why is that thing painful? Or why did it become painful in the first place? And if you start asking that question, well, why did it become painful in the first place? Then you start looking at the painful structure as a victim and not the culprit. It becomes the result of the problem rather than the problem. And if we start looking at movement and strength and coordination and balance as part of the reason why tissues become painful, then we can start to unwind those problems and the painful tissue calms down.
Mhm. Makes sense. So, what happens when people delay therapy to try tough it out?
Um, well, obviously, if you have something that is painful and you're not addressing the underlying problems, that that painful tissue is going to continue to get beaten up, and sometimes that um, can lead to a situation where you know there's more failure, as in get degenerative joint disease to the point where you need a total joint. Um, Again, I think that the vast majority of people, they feel pain in a region or a joint, and immediately they think, okay, whatever that painful thing is, we need to do something to that thing. And that could be, sometimes they want to take a picture of it. Sometimes they want to put a cortisone injection in it. Sometimes they want to cut it out with surgery, or they want to sew it together with surgery. And I would make a strong argument that improving the neighborhood in which that structure lives is a really important piece to do first, because either that's going to resolve the problem in terms of pain and function, or it's going to make that person a much better candidate for other treatments like a cortisone injection or surgery. Um, I find that a lot of people think that they want to have surgery first and then do physical therapy second. You're almost always going to have physical therapy post surgically, but it's really important to do pre-surgical physical therapy to make yourself a much better surgical candidate. And so that we're not having to deal with a lot of these issues post-surgically that are more challenging or sometimes can be more challenging to resolve.
That's eye opening. Pain isn't weakness, it's communication. Ignoring it only deepens the problem.
Well, and then, then you start talking about some of the biopsychosocial issues where you feel pain and that painful stimulus uh, creates anxiety and fear of movement and avoidance of movement, and the person gets more and more weak, which creates more of a mechanical problem, which creates more of a pain problem, and that pain problem again creates more anxiety and stress, and that's where we see a lot of our chronic pain folks. And clearly you can have a straight mechanical problem that turns into a chronic pain biopsychosocial problem. And then so to deal with that, then we have to both unwind the mechanical problem and the biopsychosocial fear and avoidance of movement problem.
Absolutely. So, you specialize in manual therapy and physical exercise. Can you break that down for our listeners? Like, what exactly does that look like in a session?
Okay. Manual therapy is one of the oldest forms of medicine that you can imagine. It is basically isolating out joints and wiggling them in specific ways to restore motion. That is a very rudimentary understanding of what that is. But to do manual therapy properly, you are looking at how the whole system is moving. You are identifying joints or soft tissues or nervous tissue that isn't moving properly, and you are able to isolate out those either tissues or joints and get them moving. And then with functional exercise, it's really important to reteach the body to move this joint in function. So once we have restored some mobility, say in the hip or in the pelvis or in the lumbar spine, then it's really important to go out into the gym and gently use that motion, because a lot of times people, again, with chronic pain, have fear and avoidance of movement. And so we need to have these gentle, very simple movements to reteach the brain that this is not a threat and this movement is normal and natural and should be performed. And as the person regains some mobility through that manual therapy, and their body is taught how to deal with that movement with functional exercise, then you can start layering on some loading uh, such that the person can tolerate different forces, whether that be their body weight when they do a step up, or whether that be lifting something overhead for a shoulder or a neck, so that you can have a combination of movement and strength, and then you can pile on some more coordination and dynamic stability, and get the person back to doing the things that they want to do.
hmm So, what kind of results do your patient typically experience with this approach?
Well, most of the time, um, over the first, say, month that I'm working with someone, we're really focusing on mobility. Depending on, you have to take patients where they are. Some are athletes that are having trouble with their fifth mile of running. Some are older folks that haven't done much of anything in a really long time. And so you have to work with whomever you have and take the patient where they are. Again, some people have chronic pain sort of syndromes where they have a lot of fear and avoidance. And so we start with breathing and uh, getting the central nervous system to calm down. Once once we've gotten some movement going over the first month, um, again, typically over the second month, we are doing that dynamic stability program and working on that to improve endurance, to improve strength, to improve balance and coordination, such that the person can get back to the function that they want. And ultimately, it's up to the patient what they want to do. But my goal for the patient almost always is to give them a program that has a mobility component and a dynamic stability component that they can take with them for forever. And they don't need to necessarily do that program forever. I typically tell patients to do that program for 3 months and then get into whatever exercise program that they want to, whether it's the YMCA or some other gym, or whether they want to do some yoga, or they want to do some Tai Chi, or they want to do some kickboxing, or it just doesn't matter. As long as you're doing a combination of mobility and dynamic stability, then you're doing a lot of the right things.
Incredible. It's not just about pain relief, it's about restoring trust in your body.
Absolutely. Yeah, that's a really nice way of thinking it.
Mhm. So, chronic pain doesn't just affect the body, it impacts mental health too. So, how do you help clients navigate that emotional layer during treatments?
Um, a lot. Sometimes I will refer the person to a psychologist or a counselor who specializes in chronic pain. I think that can be a really beneficial thing. I use an app called Curable, is a pain science app that patients can work with to understand more about pain science and understand more about how to work with the pain that they have. Um, but also, I think it's really important to talk with patients about what pain is and what pain is not. And the idea that pain is not damage is a very important piece of the puzzle. I also don't particularly like talking about positional fault issues. So, what I mean by that is a lot of times different types of practitioners will say, okay, you're out of alignment. And I don't like that phrase because if you're out of alignment, that sounds like that's a dangerous place for you to be. And if you do something while you're out of alignment, that could be catastrophic. And I don't like that idea. Number two, if you're out of alignment, that doesn't sound like something that you can help yourself. That sounds like you need some sort of guru to put you back into alignment. And so I like to talk about movement dysfunction and strength dysfunction because those two things sound like something that the patient has some agency over and they can take care of and they can work on themselves. And I think when you can demonstrate to patients that movement is the answer, not the problem, and you can show them that pain is not damage, and you can get them moving in a safe environment, then you can retrain their brain to understand that movement is going to be the answer rather than the problem.
Mhm. Right. So, what's one mindset shift you encourage in those who have been dealing with pain for years?
Um, the biggest mindset shift that I work with patients on is to, if you have images that show normal aging process, degenerative joint disease, most of that is not terribly relevant to your situation. Um, I'm not saying that images can't be important in certain situations, and I'm not saying that images shouldn't be done if the person has something that is clinically looks like something that needs to have a surgical intervention, right? There's a time and a place for surgery for sure. But if you have an x-ray that shows degenerative joint disease and you're 60 years old, the reality of the situation is almost everyone who is 60 years old has those findings on that image, and not everyone has pain. And so that that finding on an image does not equal pain. And I think that's a really, really important piece of the puzzle, because I don't think practitioners are taking the time to see how patients are moving. They're not really asking them the questions about what makes their pain worse and better. They're not really doing a physical examination such that they can identify both the painful structure and the some of the stiffness and weakness that is causing that structure to be painful.
That's so needed. Healing isn't just physical, it's deeply psychological too.
For sure.
So, what are some common myths or mistakes people make about managing their pain?
I think the thing that I see most often is patients will come in and they'll say, "Man, my shoulder really, really is painful when I do this one certain motion. So I've been doing that motion over and over to try to stretch it out in that way." And I kind of chuckle a little bit, like, let's not just punch that painful structure over and over again. Let's figure out why that structure is painful. So if something is painful, just going in and beating it up with a stretch, or beating it up with a foam roller, or beating it up with a um a percussion massager is probably not the right answer. And we should stop looking at that painful structure as the problem, as opposed to it being the result of the problem.
hmm So, how can someone know it's time to stop managing symptoms and start addressing the root cause instead?
That's a really good question. Um, I don't have a great way to um, decide when it's time to come in for physical therapy. If you are, hopefully everyone is doing a exercise program, right? And I know that's not necessarily a realistic assumption, but for the sake of argument, let's say that you're doing an exercise program. If you're having trouble doing different exercises, whether it be walking or running or biking or some sort of gym, like class, Zumba class or whatever, if there are certain moves that you can't do and without pain, then that's an interesting thing to look at. If you notice that you can move one way, but then when you try to move the opposite way, you don't move as well, or one leg doesn't move as well as the other, then it's probably time to have somebody look at it. And the a lot of times, the earlier a person comes in for physical therapy, the less physical therapy they need to do. If that structure is not terribly painful and they just have a little bit of stiffness and weakness, you'd be surprised. It might be just a couple of visits where we're working with the patient to um, just do some specific exercises that will address their specific biomechanical dysfunction.
Truth bomb. Just because pain is common doesn't mean it's normal.
Yeah, well, I mean, I guess the flip side of that is that I kind of like to say life is pain. Everyone has some amount of pain, uh, especially if you're not 20 years old. If you think about it from an evolutionary standpoint, most of our ancestors from 5,000 years ago, only the average lifespan was 35 years, and now we're living more than twice that. And then when you think about how little we move around in the United States and in Western societies, how little we're walking, how little we're doing activities that are similar to hunting and gathering that our ancestors did for tens of thousands of years. We're both not using the device the way it was intended, and we're trying to get this device to work for more than twice as long as the warranty was evolved for, it you kind of run into a situation where some amount of pain is probably inevitable.
Mm-hmm. Right. So, for someone dealing with nagging back, neck, or joint pain right now, what's one simple thing they can do today to begin healing?
Ooh, I think if I was to say what the average person should start with is if you think of what a sitting posture is, where your hips are bent forward and your back is sort of rounded and your head is out in front of you and your shoulders are rounded and down, that sitting posture is is pretty ubiquitous throughout society. What you need to find is finding a way to get out of that posture and do the opposite of what that posture is some amount of time during the day. It doesn't have to be, it's certainly not a one to one, but you have to be able to get out of that sitting posture, get hips moving better, get upper back moving better, get shoulders moving better. That's at least a start, a mobility program. I find that so often, even the patients who are in good shape, athletes and whatnot, especially my older guys, they'll come in and they're doing a really good work lifting weights, and they're doing some cardio, but almost no one is doing enough mobility work. And one of the things that I always say is, if everyone did yoga from the age of 5, I probably wouldn't have a job.
Mm-hmm. Absolutely. And what's one thing you wish everyone knew about physical therapy?
One thing I wish everyone knew about physical therapy is the best place to start when you have muscle and joint pain. Any kind of musculoskeletal pain, physical therapy is absolutely the first place you should go. If that physical therapist sees a red flag that is something that is inappropriate for physical therapy, that practitioner will send you to someone more appropriate. We are trained to identify pathology that is outside the scope of our practice, and we're not interested in making things worse.
Mm-hmm. That's empowering. Healing is possible, and it often begins with one informed step.
Absolutely.
So, David, thank you for reminding us that pain doesn't mean we are broken. It means our body is asking for help. And to our listeners, don't wait until the pain becomes unbearable. Trust your body, start small, and take healing into your own hands. So, until next time, move intentionally, listen to your body, and remember, your path to healing might just start with therapy, not surgery.